Good afternoon, everyone. I'm Dr. Jency from Acharya Managed Hospital. So today is a World Diabetes Day. So we would like to share few of information to everyone. So we have Dr. Nikhil Varge. Sir is a medical director of ACI Managed Hospital. So sir, we would like to know more about diabetes control and how we can bring it to the system so we can share information to all of us. So.
Sure.
Yeah, so the first question is like, is diabetes really a growing threat or it's just a myth?
So Jency, that what we are currently seeing is a very disturbing trend where we can see number of patients with diabetes are growing day by day. This situation is particularly very important for countries like India, where the obesity is a new menace that we are facing. Obesity nowadays is not seen only in adults but also in children. So what we consider is obesity, overweight and diabetes are part of the same spectrum of diseases. As we can see in India, the prevalence of diabetes is definitely increasing. The prevalence is more in South India compared to North India. There was a study recently concluded which was done by V. Mohan's Academy with, in association with ICMR, and they have found out that in India approximately 10 crore people are currently having diabetes and almost close to 12 to 13 crore people are having pre-diabetes, which means that these people will turn into diabetes unless and until we do some specific interventions that will prevent them. It is expected that as we have exceeded China in number of in the population rank in this year, we will soon be the diabetes capital of the world. So India is likely to have maximum people with diabetes by 2030. And of course, we all practicing physicians and diabetologists are trying so that this can be averted. We don't want to have this ill-famed tag of being the capital of world diabetes. Particularly because diabetes is not a straightforward disease to manage. It is a lifelong problem and it comes with a variety of corresponding issues that we need to take care of. So yes, diabetes is a real threat and we all need to be aware about it.
And sir, can you just let us know the types of diabetes which are?
Yeah. So there is always a discussion whenever the patients come to us and they always keep asking us what type of diabetes they have. So as I told you that India is having a lot of people with diabetes, you can say more than 2 to 3 individuals above the age of 30 will have some or the other form of diabetes. Of course, the commonest type of diabetes is called type 2 diabetes mellitus, which is the predominant type and which is obesity related and lifestyle related. So other types of diabetes are there, like type 1 diabetes, which occurs in young children and young adults, and it is because of deficiency of insulin. Sometimes diabetes can also occur because of damage to pancreas where the insulin is normally secreted. Initially, these diabetes types were classified as insulin dependent diabetes because they required insulin for the treatment, and the other type was insulin independent diabetes or non-insulin dependent diabetes where insulin is not always necessary for treatment. Nowadays, when we do not specify and we just say diabetes, by convention it means it is type 2 diabetes that we are discussing about, because it forms the majority. 90% of the patients with diabetes are of type 2 diabetes. Other types of diabetes, as I told you, are type 1 diabetes where insulin is required, and there are certain monogenetic types of diabetes also, in which there are certain genetic abnormalities where there are certain hormones or certain enzymes in sugar metabolism which are not produced, and these people also get diabetes. So commonly type 2 is the most common type of diabetes, and it is the one where the lifestyle interventions can play a part. As far as type 1 diabetes is concerned, there are not very interventions which are there which can prevent this form of diabetes. It is dependent on various environmental factors and to some extent genetic predisposition also. So this is how we generally talk briefly about types of diabetes.
So juvenile diabetes comes under?
Yeah, juvenile diabetes is some of those. Juvenile diabetes is basically the age group that specifies diabetes. So some people develop diabetes from the age of 12 to 20. Some of them can have type 1, which is insulin dependent diabetes. Some of them can also have maturity onset diabetes or young, which is called MODY, which is actual monogenic diabetes. So there are ways to classify these diabetes. Now there are certain genetic tests or certain other tests which are available to classify these diabetes. And this typification of diabetes is very important because unless we identify the right type of diabetes in you, probably your treatment might not happen in the correct way. So that is why we try to have set up a department of diabetology in Nanish Hospital where we dedicate that much of time to patients in classifying which type of diabetes they have, identify those risk factors and accordingly modify the disease so that they have a long-term disease-free course.
The crucial set type of diabetes, which is like for the patient, what type of diabetes?
Yes, identifying the type of diabetes is one of the most important factors as far as the management of diabetes is concerned.
And so what causes exactly the diabetes, are major contributing factors?
Yeah, so as far as the causes or risk factors of diabetes are concerned, because as I told you, the type 2 diabetes is the most common variant and it forms a majority of chunk of diabetology practice or diabetic patients. Now, type 2 diabetes is considered to be occurring because of multiple factors. Lifestyle is one of the most important factor here because nowadays we have westernization of our lifestyle. We follow western kind of food where we take energy rich or carbohydrate rich diet and we follow sedentary lifestyle. We travel to our offices, we work on a single day for 8 to 10 hours, then again the lifestyle stress of not being having enough time to exercise or physically active. So this lifestyle modification or lifestyle problem is one of the most important risk factor for development of type 2 diabetes. Second risk factor becomes obesity. Obesity nowadays is more common and in particular the abdominal obesity where people put on a lot of weight around their abdomen is the most important second risk factor. Third risk factor becomes some addictions like people having alcoholism, smoking history can have predisposition to diabetes. Some people are on certain medications, for example, when they are on some life-saving drugs like steroids which can precipitate diabetes in them. There are certain particular conditions like pregnancy. In pregnancy, in second trimester, there is a relative resistance to insulin action and these people can develop gestational diabetes, that is we call it a special type of diabetes. And there are also other co-associated risk factors which can be there like certain endocrine conditions. Some people have hypersecretion of their steroid hormones, they can develop diabetes. Some people have hypersecretion of growth hormone, that can also cause diabetes. On the top of that, there are certain conditions in which, as I told you, there are some genetic mutations which alter the metabolism of glucose and that can also lead to diabetes. Now what happens because of these all problems is, there are certain organs in our body which are going to function in correlation with each other. And there are 7 to 8 important organs that have been identified. Most importantly is pancreas. Because pancreas is an organ which is going to secrete not only insulin, which is important for sugar control, but also it secretes glucagon, which is a counter-regulatory hormone for insulin and which can increase sugar. So pancreas is the main site of diabetes origin. Second most important organ is liver, because liver is organ which actually controls the flow of all these metabolic nutrients into the bloodstream. So you can assume that whatever food is digested, it passes through liver. Liver tends to store most of these nutrients and gradually release them into the bloodstream. Same thing happens to glucose also. Glucose is stored in the liver in the form of glycogen and gradually it is released into the bloodstream as glucose because there are certain organs in your body, particularly the brain, which can only metabolize glucose and nothing else. So your body requires a continuous flow of glucose and liver is an organ to regulate that. Third most important organ is your skeletal muscles. Your muscles are one of your largest organ of your body and their metabolism, how sensitive they are for use of sugar in the presence of insulin, what is their capacity to store sugar or glycogen, what is their reaction to changing environmental milieu is also one of the organs which is contributing. Fourth organ is your adipocytes or fat tissues. Fat cells not only store fat in the form of calories, but they also produce certain hormones which can alter the metabolism of glucose and that can lead to certain changes which can cause diabetes. Along with that, nowadays it is recognized that certain other organs which can also contribute to the origin of diabetes are brain, because it is after all the center of brain which causes an urge to eat. It is the organ which also decides the satiety level. Similarly, kidneys. Now kidneys have a very important function of filtering out your blood system, as well as kidneys are the organs which exceed sugar when it is excess, when it is in excess. And kidneys also reabsorb some of that sugar depending on its mechanism. So nowadays it is identified that brain and kidneys also have some dysfunction which correlates into formation of diabetes, or that leads to development of diabetes. So there are certain environmental factors and there are certain body processes. There has to be a complex interaction between these two to actually form a diabetes. But by far, my most important risk factor for diabetes has been identified as obesity and sedentary lifestyle. So it is important for all of us to understand that if we can conquer this obesity and sedentary lifestyle, definitely we can prevent this diabetes and also control it very well.
So what are the ways to, as you rightly said, we can prevent it? So what are the different ways we can prevent diabetes?
So this concept is nowadays very much important, and it is very well accepted that can we prevent these diseases. Now, as we talk about diabetes, we have defined, there is a world over defined criteria for diagnosis of diabetes. And when we say there is a condition which is diabetes present, if the fasting sugar is more than 126 and when the post-prandial sugar is more than 200, after food sugar is more than 200. But we have a different set of for normals. For example, a fasting of less than 100 is considered as normal, and a post-prandial sugar of less than 140 is considered as normal. So we understand between the diagnosis of diabetes and between normal, there is a gray area which is called as pre-diabetes. Now this is the population which is predisposed or which is likely to develop diabetes over a course of time if we do not make interventions. And as this is the era of a preventive medicine, we want to prevent these people from developing diabetes. So as far as the prevention of diabetes is concerned, it is directly linked to the risk factor that we just discussed. So obesity, sedentary lifestyle, high energy or high calorie foods, you can say fast food, and you can say physical inactivity, long sitting hours. These are the factors that we know can contribute to diabetes. So these are the factors, if we take care of, probably will be leading to prevention of diabetes. So we come across a lot of patients, a lot of families from diabetic families where their children or their younger generation are at risk of developing diabetes, and we always tell them that they should start following the diabetic diet, even if they are not diabetic but they are pre-diabetic. We ask them to control their weight or lose weight. We particularly ask them to reduce their waist circumference, because the weight or inches lost in the abdomen contributes maximally to prevention of diabetes. So if we change our diet form from energy rich to high fiber diet or low energy intake, or we start taking diet with low glycemic index where the sugars are released slowly in your body, probably that is one of the ways to look forward for prevention of diabetes. And the importance of exercise cannot be replaced, because that is one intervention which will lead to multiple benefits. It leads to weight loss, it leads to increased insulin sensitivity, it leads to better glucose metabolism. Not only this, it also leads to prevention of blood pressure, and it also leads to prevention of hypercholesterolemia. So there are multiple benefits, and that's why we always stress people that they should be living an active life. They should be fit. All of us work throughout night and day, and we all follow our life's goal in terms of career, in terms of position, and a lot many. I think it is also important that we should have a goal set for our health, and for that we should reduce our work by a little extent. Maybe 1 hour of your work you can reduce, and you can spend that into quality physical activities. That will really help.
And so one more thing is that you said that we get the base in preventing. So is there a particular age group where we can just keep on checking for pre-diabetic?
Yeah. So now there are two types of populations that we come across. One population who has first degree relative having diabetes.
Mm-hmm.
For example, if their parents, their grandparents, their uncles, their cousins have diabetes, then of course your risk of developing diabetes is always more. So first thing to check in these patients at any age group is, are they following a good weight pattern? So even in their adolescent or young age, if their weight patterns are followed, it's a good habit. But if they are already having obesity, if their weights are increasing, they need to start checking for this presence of prediabetes. Sometimes you might not find prediabetes, but their weight control will definitely help. Sometimes you will find that they are having prediabetes and their weight control improves prediabetes. So prediabetes can be taken back to a normal state if certain lifestyle measures are followed. Now, if there are certain individuals who are having onset of diabetes in their families at younger age. For example, if somebody has a father who has been diagnosed with diabetes at age of 45, we should start screening in them at least 5 to 7 years earlier. Because we have to assume that if in his father the diabetes was diagnosed at 45, maybe the diabetes was present 2-3 years prior to that. Because diabetes is a disease which doesn't cause symptoms as such. So that's why it's called a silent killer. So we should screen the family members at a slightly younger age so that we should be able to find out preventable risk factors. Other than these families who have a family history of diabetes, those people who are having obesity, by and large, even if they do not have family history, they can still develop diabetes, and that's why obesity has to be addressed. And nowadays, I think we are doing a lot of health awareness on that part. We are discouraging the fast food culture. We are encouraging exercise and sports in schools. So probably that is one of the ways of preventing those risk factors from developing itself. So we can say this is a primordial prevention.
Okay, so can you tell us the diet, everyone, like what diet we should take if you have diabetes? You can share a few tips.
So I think a lot of people do resort to internet and YouTube for following diets, and there are different types of diet suggestions which are already there everywhere. But whether that diet will suit everyone, that is the most important question. For example, many times you will find that there are husband and wife living in the same house, eating same kind of food, but one having diabetes and other one is not. That itself gives you answer that one size will not fit all. So there are certain diet patterns, there are certain fasting patterns which are being promoted, but you can understand that same diet pattern cannot cause similar weight loss in all populations. That is the same basis on which our diabetes prevention is based. That same diet will not suit all. But there are certain general principles that we follow in people with diabetes. We have to assume that people with diabetes will not be able to handle sugar load. They will not be able to deal with sugar load in a very easy way. That is why we always tell them that they should have foods which have low glycemic index, in which the sugar content is present but it is digested slowly. Generally, we describe this in such a way that if you take a Glucon-D powder, you don't have to even swallow or mix it with saliva for getting absorption. Glucon-D, anhydrous glucose, it absorbs from your oral mucosa just even if you put it there. If you take sugar crystals, your saliva has to be mixed with it, and probably that is a source of initiation of sugar absorption from there. There are certain food items which will be digested in early pre-gut, and there are certain food items which are having complex carbohydrate which are slowly digested and which will release glucose slowly. That's why we always encourage the people with diabetes or who are on weight loss regimen or who are having pre-diabetes to take more intake of complex carbohydrate. Complex carbohydrates are complex starch. So you can take whole wheat flours or multigrain attas, and these are the things which will help. You have to avoid simple refined flours. All the maida items and maida related items have to be avoided. Cookies, bakery items, breads are strictly a no-no for people with diabetes. Sweets and sugar items generally they all avoid. We also have to understand that simple carbohydrates like rice and potatoes are also very rich in glucose and it gets absorbed very fast. So again, we have to ask them to avoid those. Many times we give them a tip that they should take a lot of proteins, a lot of vegetables, a lot of fibers and mix carbohydrates with them. So that slows down the digestion of carbohydrate. For example, if you have to eat a bowl of rice and instead you eat a bowl of pulao, you will have carbohydrate mixed with fibers and vegetables. Probably that will slow down the absorption of carbohydrates and that will be more useful for you. So There are various ways there where we encourage people to take more salads, more sprouts, more fruits, which will have low glycemic index and high fiber content. And this reduces their overall calorie intake. Also, this reduces the speed of absorption of glucose into their bloodstreams. And when this happens, many of the patients can cope up with their glucose control in an easy way.
So, because we have always heard that people with diabetes should not eat rice completely. So, is it true, or maybe a proportionate kind of quantity maybe we can have?
Yes, that is what we can do. We can give them a small portion of rice, and generally that is what we can encourage for people who have controlled diabetes. When they have an uncontrolled diabetes like HbA1c more than say 9 or 10, generally at that moment we ask them to avoid rice completely. But once the HbA1c comes to a good control at say 7.5 or less than that, we generally we can allow them some amount of rice. But again, as I said, very little quantity, and they have to monitor sugar, because many people after rice their sugar levels tend to go up.
Okay, and so the medications part. So once we start having the medications, and if the diabetes is under control, so I heard patients saying that diabetes level control may have. So should I continue taking the diabetes medications?
Yeah, that is one of the common questions that many of patients come and ask us. But we have to understand the fact that sometimes diabetes is controlled by medicines. So if you take out the medicines, the diabetes control will be lost. What is a better strategy in these cases? Because we always encourage our patients to understand their diabetes, and we always tell them the diabetes control remains with them to a large extent up to 60%, because they control diet and exercise. And the diabetes control stays with the diabetologist for say 30-40% where we add medicines. Some of our patients do their diet and exercise part so well that their HbA1cs and their sugar control and their cholesterol control is very rapidly improving. In that case, as any learned person would understand, that we will ourselves start reducing the medicines. From 2 medicines, so some of them come to 1 medicine, from 2 drugs they come to 1 drug, and if gradually they are maintained, we do take off the medicines also. What we also try to educate them is, even if the diabetes is well controlled now, their tendency for diabetes will not go away, and there is always a chance that if they do not follow the precautions and they do not follow the diet and exercise patterns, the diabetes might shoot up again. So these patients can be monitored by reducing medicines and sometimes by stopping medicines also if their sugars are controlled, but their monitoring part has to be continued, and their compliance with diet and exercise has to be continued. There are instances, there are a large number of instances where our patients have gone off the medicines and they're happily doing it, but they still come for follow. They still keep on checking up their values, because that is an important part of the strategy. So diabetic medicine can be reduced and can be stopped also. It's not a myth.
Good to. It was very good information for us, sir. And so, how is obesity directly related to diabetes control?
Yeah, as I told you, the risk factor for diabetes includes obesity, because more the adipose tissue, more obesity is generally associated with sedentary lifestyle, and that leads to certain changes in your body's physiology where the sugar metabolism is affected. Of course, there is a chance that the insulin resistance will occur. So insulin might be secreted in your body, but it will not be having a good effect. Obesity also reduces your compliance with exercise. Just imagine there are 2 individuals, one is obese and one is lean. If I ask them to walk, probably a lean individual will be able to follow the exercise regimen well. So that works in diabetes. So obesity is one of the predisposing risk factors, as well as obesity is also one of the major hindrances and obstacles in the management of diabetes. Because yes, today we can say that the BMI indices in India or in Asia are reduced. At one point of time, the body mass index of more than 25 was considered as overweight. Today in Asia and in India, a body mass index of more than 23 is considered as overweight and obese, because Asians and Indians in particular have high predisposition of abdominal obesity, and that leads to formation of diabetes or development of diabetes. So obesity has a direct link because of multiple mechanisms, because it affects liver, it affects the functions of pancreas, and it also affects the function of skeletal muscles. That is how obesity predisposes to diabetes.
So what are the complications of diabetes?
Yeah.
It's
So
not
that
really-
is why this part is very important, because that is why we want to control diabetes. Why would we want to control diabetes? Because we understand from multiple studies across 5 to 6 decades that the long duration of diabetes, that is one, and bad control of diabetes, that is two. These are the risk factors which put stress on multiple organs in your body. As we all understand that with age, our body organs are going to have some deterioration of function. For example, kidney function is approximately deteriorating 1% every year from the age of 25 to 75. So 1% reduction in kidney function is occurring as a part of aging. Similar aging is occurring in our most other body organs, including the heart, including the blood vessels. Now, if you have diabetes for long duration, and in particular if the diabetes is uncontrolled, it is going to form certain metabolites in your body like advanced glycosylation end products, we call them AGEs. And these AGEs cause faster aging of yourself. So your body organs will tend to have certain changes which were supposed to happen on a slower pace, they all happen at a faster pace. So we see a lot of people with young diabetes and they have blood vessels which are similar to 70 or 80 year old. So that is why aging, deposition of cholesterol in blood vessels, deterioration of heart function, deterioration of nervous function, deterioration of kidney function, these are the major complications that we see in diabetes. For theoretical purposes, we describe the complications of diabetes as macrovascular and microvascular. Macrovascular complications are damage to heart and kidneys and the blood vessels of the leg. These are macrovascular complications. And microvascular complications are again to some extent on the peripheral nerves, retina, and smaller tubules of the kidney. So these are the two ways we classify the complication of kidney. And two most important complications that occur in people with diabetes is heart disease, which is similar to heart attack, and kidney failure. I can today say that 75% people in India with kidney failure or who are on dialysis because of diabetes. Similarly, more than half of the patients who develop heart attack develop heart problems because of diabetes. Rather, diabetes is itself considered as a heart disease equivalent. So, as if one person develops a heart attack, his chances of having a second heart attack are already more, and which are similar to a patient who is having diabetes. So we consider a person with diabetes as good as having one heart-related event in the past. So these are the two major complications that we want to prevent because they lead to loss of lives and loss of functionality. Along with that, there is a lot of complications like neuropathy. A lot of people, elderly people with neuropathy, are struggling with the complaints of pain, with decreased mobility, with imbalance, and so on. And there is a lot of people who are also having retinal complications because of diabetes that leads to some extent permanent blindness also, which is difficult to cure unless it is managed conservatively. So these are the complications which make us worried about diabetes, and that is the reason we want to manage the diabetes in such a way that person with diabetes can live a normal life without developing these complications, and that is our primary aim.
So one last question. Just wanted to know the types of insulin, and is there that if some patients say that if we start taking insulin, we need to take it for a longer time. Is there something like that related?
So fortunately, we are blessed that newer and newer insulin discoveries have happened. Almost this is 110 years since the insulin was discovered. But now we have more refined and more high quality insulins where there are certain insulins which are rapidly acting, there are certain insulins which are slow acting, there are certain insulins which act for more than 24 hours also. There are options of insulin regimen where 1 or twice in a week insulin can also work. So insulin is an integral part of management of diabetes when the sugars are not coming under control. So many patients do well, at least in type 2 diabetes, do well with oral tablets. Some of them, whenever they develop certain complications, they land up in hospital, or when they do not get a good sugar control with those medicines. Some of them will have increasing doses of medicines are still not achieving the glucose control. That is the time we commonly used to think of insulin. But nowadays, we think of use of insulin in an early stage because it helps us get a better sugar control. See, our idea is simple. We want a sugar control to be very good. whether you do it with tablets, whether you do it with insulin. Somebody taking 3 or 4 tablets in a day and having a sugar of more than 300 is almost living a life without treatment. So there is no point of taking medicines and not having your sugars under control. Insulin today nowadays is available in the form of small handheld devices including pens. Many of the diabetic patients are taking their insulin by themselves and doing very well with it. These needles are painless. They are having so small caliber, it hardly causes any complications, and they give excellent results. So insulin usage is required in certain subset of patients, sometimes early, sometimes late, and sometimes in the state of complications. But yes, you should meet your doctors, you should ask and explore this option of usage of insulin freely with them, and if you are suggested, I think we should not resist taking insulin because that is going to be one of the life-changing drugs in your diabetes management.
Thank you so much, sir. So it was a very valuable information shared by Dr. Nikhil sir with us. So do you want to share something in there?
Yeah, we all keep on talking about diabetes often because there are certain statistics which have already been proven that diabetes people will fall more sick. There is always an increased chance of getting hospitalization in a person with diabetes. Diabetic people have more infections like tuberculosis. Diabetic people will have more infections like urinary tract infections. Diabetic people will have more complications when they get diseases like COVID. So we understand diabetes spectrum is not limited to one particular condition. Diabetes is omnipresent. Diabetes is going to complicate every other picture and it is going to affect every other organ. So I urge you all, first, do get yourself screened if you have certain symptoms. Even if you do not have symptoms, there is no problem in getting yourself screened for diabetes. And if you have diabetes, do meet a good diabetologist. Do take proper healthcare advice on diet, exercise, and medications. And the most important part is a regular follow-up for this diabetes management. Because once you are following the diabetes treatment regularly, then any aberration in your diabetes treatment, if it is occurring, if your sugars are getting uncontrolled, if you are developing certain complications, probably your doctor would be able to guide you better how to do a better control of those complications as well. So with this, I would urge all of you to spread the awareness of diabetes to your loved ones and definitely take a help of our expert team whenever you need. We will be there in your service always.
Thank you so much.
Thank you.